Non-communicable diseases such as cancer, diabetes, hypertension or heart diseases have become a huge problem in much of low and middle income countries. In particular in the Southeast Asian sub-region it has become a big issue. The problem is that healthcare systems are not prepared to deal with this challenge because for a long time they were very much concerned about infectious disease such as tuberculosis, malaria or dengue fever. So these diseases cost these countries billions of US dollars every year to treat those people that are affected. And of course it would be much more effective to earlier prevent the disease to develop to this extent. So we are engaged in a huge collaborative research project led by the University of Groningen, where we design and field test interventions that are supposed to prevent and control the disease in 3 countries: Myanmar, Indonesia and Vietnam. My colleague Manuela Fritz will now introduce you to a Facebook campaign that we designed to prevent and control diabetes 2 in Indonesia, one of the big health issues in that country. So Manuela, what are the key design features of that campaign?
So the main idea of this campaign was actually to increase diabetes detection rates, because in Indonesia only 1 in 4 persons with diabetes knows about their diagnosis. So we implemented an awareness campaign on Facebook where we randomly distributed differently designed ads. And these ads differed on different aspects or focused on different aspects of the diabetes disease. And we then wanted to test which of these ads would be most effective in incentivizing viewers of the ads to click on it and also to perform a self-screening, so a diabetes self-screening activity that they could perform on our website.
What are the key findings of this research?
The key findings, so first it was that we can actually reach a really large number in an only very limited amount of time. So in only 3 weeks, almost 300,000 people saw one of our ads. And second, and probably the most important finding, was that advertisements that focused on a shocking perspective, or essentially on the detrimental health consequences that diabetes could have, were much more effective than advertisements that focused on a non-shocking or less drastic aspect of the disease. And this trend was a bit stronger for women, but we could also observe it for men.
Has the intervention proven to be cost-effective?
Yes, indeed, it proved to be really cost-effective. So we did a simulation exercise to get an idea of how many people would actually perform a professional diabetes test after they have seen one of the advertisements. And we estimated that given the number that would really follow up with such a professional screening and the number of people that we could then detect afterwards, it would cost around $9 to detect 1 more case of diabetes that was previously undetected.